Welcome to Three Questions, where critical thinking is king, and my opinions and research are only here to support your learning and deeper understanding. Hey, I'm your host, Megan, and I'm so honored you clicked on 3 questions today so we can dig into frozen shoulder. Now, if you've never heard of frozen shoulder, well, that's probably because you've never worked with someone who had it or had it yourself. But it is something common we see, and it is something we commonly see in women after a certain age. I'm not saying that men do not get frozen shoulder as well, but it's become, this is my opinion. I feel like it's becoming normalized for women, in the same way it's a little bit too normalized that for men after a certain age, they've got to wake up to pee at least 2 or 3 times. And while it might be common, why does it have to be normal? So let's dig into these 3 questions. Whether you've had frozen shoulder, you have it, or you work with humans, you're going to come across it at some point, and maybe you'll think back to this episode and have some cool and innovative ideas. So, enough lighthearted chit-chat. Let's elevate small talk to medium and get to it. So, frozen shoulder. Question 1. Considering that most cases of frozen shoulder are idiopathic. Idiopathic means no known cause. Okay? It's like my least favorite word. And poorly understood. Now, this is not just my opinion. This is from doctors. This is from the literature. Most cases of frozen shoulder are actually idiopathic, and there's a big lack of understanding. So how can we all stay curious and avoid being overconfident in our treatment plans? So to give you like a sub-question to chew on is like, what questions can we ask our patients, friends, or ourselves to get a fuller picture? So let's break this question down a bit. So how annoying, you wake up with frozen shoulder and it sucks. How do I know? Well, I've experienced it. And no, despite the fact that I have wrinkles and make a lot of facial expressions, I'm only 43. So while I am in perimenopause, I'm kind of starting it now. I have not gone through menopause yet. So I don't fall into that common category. But my experience was I went from having no shoulder pain to waking up one morning and not being able to move my left arm at all. Okay. Now, because I do this work and I understand neuro, I have a hypothesis what the cause was for me. But it's just that I have hypothesis, easy for me to say. It's like a story I'm telling myself based off a lot of factors. So right now, maybe you haven't had frozen shoulder, but have you had a shoulder injury? So I want you right now to think about all the things that could contribute to your shoulder injury. Like maybe you fell as a kid, dislocated your shoulder. Maybe you've been lifting heavy and you have a slight rotator cuff tear. But notice all the things you're thinking about are very shoulder related. Well, what about your feet? Huh? Feet, you say, Megan? Yes. What people love to forget is that the whole body's connected. So if you have poor sensory information from your feet or lack of what I call foot to hip connection, that's going to affect your hip joints' ability to stabilize and respond appropriately. I've seen a new pathology of glute amnesia. Ugh, annoying. Now, your glutes are fine. Your glutes aren't getting enough sensory input to activate. So while people like to put names on things, that is a result of another problem. It is not a disease. There's nothing wrong with your glutes. They're just kind of deaf to whatever you're talking to them about, right? So if that's the case, one of our largest muscles, our lat, your latissimus dorsi, you might see that lat pulled out at the gym. Okay, that's the only muscle, and I hate even this because like everything's fascially connected, but it really connects your lower body to your upper body. Kind of starts at the pelvis there, grabs your lower back, the thoracolumbar fascia, has a little bit of a spot on your shoulder blade where it attaches, and then it inserts on your humerus. It's actually an internal rotator. So if the glutes aren't firing appropriately, it's going to affect your lat. And man, if your lat is, I I don't like to call inefficient. I say ineffective. If it can't express itself fully, okay? So our lat kind of, pulls, think about the lat pull down. When we're bringing our elbow towards our body, and pardon me if you're not watching me on YouTube, you can't see what I'm doing, and internally rotates it. So if you're trying to do overhead movement and your lat can't fully express itself, I don't even want to say lengthen or shorten. I want to say if it can't fully express itself, that's almost like a mouse running on a wheelie thing and someone like putting another mouse, like putting a foot in front of it. Okay, you're gonna have to over-recruit. You're gonna have to pull your humeral head out of centration. You're gonna have to do weird-ass shit to overcome that lat. And you wanna know the secret? You cannot overcome an inefficient, unhappy, an uncurious lat, okay? So yeah, your foot could be contributing to your frozen shoulder. In my case, I had to have a large part of my arm removed. I know that sounds dramatic. I had a big chunk of skin cancer on my left arm. Now, that's not what caused the frozen shoulder. She was the straw that broke the proverbial camel's back for me, okay? So I want you to stop putting blame on one thing. It wasn't because you bent over or did something or you did this or you were lifting at the gym. Don't blame yourself. Blame the fact that you weren't adjusting to your sensory environment. Maybe you're older now. Maybe you're still young. Maybe you're going through puberty. We're going to hit this question up later. But day to day, our body responds differently to sensory input, right? Ever wear the same pair of jeans and like one day you're like hot to trot? Did I just say hot to trot? What am I, 85? Anyway, you're feeling good, right? You're feeling yourself. Everything looks good. Everything's fitting good. Ass looks good. Then you put them on like 2 days later and you feel like a stuffed sausage, right? Now, there's a lot of factors of why that happens, but same pair of pants, I'm sorry, you could not have gained that much weight in 2 or 3 days, okay? It's how our brain is responding to the sensory input of the pants, okay? You also might be bloated, so there's more pressure, a lot of factors. So as a practitioner or as someone living with frozen shoulder, let's not look at one thing. I say this to my mentees all the time when they ask questions in the Q&A. I'm starting to feel like a dick, but they'll be giving me a problem. And I'm like, cool, but what about the rest of the body? So right now, I want everybody to ask yourself, how can we better support a frozen shoulder? Okay? Think of your frozen shoulder as your closest friend, right? That close friend that you see who's making some bad choices. She's picking the wrong man or woman. She's a good person. She just keeps making bad choices. Not terrible choices, but little bad choices that might bite her in the butt later. Okay? She hits a place where things get really bad. She's talking to you about it, or he's talking to you about it. Do you think they want you to point out all the things they've done wrong and you tell them how to fix all their problems? Or do you think they just want you to listen? Now, right now, you might be like, yeah, but she needs to know what she did wrong. Well, you are a prosecutor, not a good friend. How do I know that? Because I've been a prosecutor. I think of one of my closest friends from college, Diana. Shout out to Diana. I remember one time getting mad at her. Diana might not know this, but Diana, if you're listening, you'll now know this. I think what it was, also, shout out to Mom. As you all know, I'm very close to my mom. Something they both do very well is listen. They might be judging, but they're not like offering all this advice. And I remember it significantly. I was in a bad place and we were in Florida visiting my parents, and I was telling her what I was going through, and she just sat there looking at me. And I was like, does this bitch not give a shit? Why is she not chiming in and telling me what I did wrong or supporting me or answering solutions? And I finally said something. And she's like, huh? She's like, well, I'm just listening. And if I'm being honest, when you talk, like sometimes if I just stay back and listen, you just talk in a circle and solve your own problem. It's kind of remarkable to watch. And that was such a huge lesson. Is here I am thinking she's not engaged in the conversation and caring what I'm thinking about or talking about. Instead, she actually is so caring that she's going to let me solve my own problems and not tell me everything I did wrong. Okay? So this is an example from my life, but it goes to this frozen shoulder. Is with our shoulder, it's telling us all these little things that are wrong, right? And we kind of don't listen. So right now, and maybe this won't help your frozen shoulder. Maybe it'll help you be a better friend. Maybe you'll be a lot more like Diana. Think right now, how can you better support your friend, your shoulder? How can you listen to it? Well, sometimes my knee hurts, but it doesn't hurt all the time. And like sometimes my other shoulder blade hurts, but like not all the time. Sometimes I get headaches. Sometimes I have a hard time concentrating. All these things are factors into why our brain goes into a protective response. And yes, question 2 is, if frozen shoulder is a protective response, which a lot of literature is pointing towards, it's a protective response, not a mechanical failure. So how can we, going back to question 1, ask better questions to get a fuller picture and better assess the nervous system to focus on more support? Okay? So I wanted to bring into question 2 to question 1. We know some things. We know frozen shoulder is often idiopathic. Now, I'm saying often, not because I'm afraid to put it in with my whole chest, but we don't know for 100% that it's 100% of the time idiopathic. So what I'm not going to do is say something that I don't know is true, because then you're going to be like, frozen shoulder's idiopathic, then something comes up and then you'll look like an idiot. And I do not want you to look like an idiot. Okay? At this point, how I treat frozen shoulder is that there is no one singular cause. I look at the factors and I look at it that the brain is protecting itself. And then we go back. So, circling back to question 1, I want you right now to think one question you can ask yourself or your clients to get a fuller picture. What is one question that could really unlock some things? Think about it. Should you go big with nervous system? Should you go big about learning styles in their childhood? Should you ask them about their sleep? Okay, all these things matter. What's the client's biggest concern? They often want to be out of pain, right? So what I like to understand is how people are taking in sensory information. I ask them often about their diet, not because I want to know about weight loss. Do they feel full often? Are they picky about their clothes? Are they specific about how they move? Do they have digestive disorders? Do they wear glasses? Do they have trouble making eye contact? Do they have dental issues? Do they get headaches? Now, all of these questions are getting to the fact of how they integrate sensory information. Do they feel full? Okay, so I want to know what their interoception's like. Are they in tune with their body? Are they too in tune with their body? And when I say too in tune with their body, is sometimes those feelings are so big, they overtake the actual sensory picture that's coming in. Why did I ask about their eyes? Well, can their eyes focus? Can their eyes gaze stabilize? Do they have a small visual field? Do they need glasses? Could their glasses be limiting their visual field? Now, why does that matter, guys? Well, if we don't have a big visual field and we're wearing glasses that limit, we have to turn our head and neck a lot to see things, to get the sensory picture. And when we move our head a lot, when we don't think we're moving our head, that might indicate some spinal instability. And when our spine can't stabilize, it's going to affect our shoulder movement. Why did I ask about dental issues? Well, if they're a tooth grinder, if their gums are receding, if their teeth shift around a lot, I know something's going on there. What's the shift? Why are they clenching their jaw? Why are they moving their jaw so much? My jaw instability is one of the major factors to my shoulder. I remember teaching a class. This was shortly after I got frozen shoulder. I woke up one morning and couldn't lift my left arm. Now, I didn't panic. I had to teach a lot of classes that day. So what I did was taught a class for full body integration. We started foot to hip, and we were working on sensory feedback, distally to proximal. So guess what? In one Pilates, I don't want to call it Pilates-based movement class. Now I was teaching it, so I was able to select the exercises, was able to take an arm that couldn't move at all and get it to move about 70%. Now, what's interesting was whenever I was exercising, brain-based exercise, not just randomly exercising, when I was focused on what my right foot to hip was doing and my right shoulder girdle and spine, my left arm moved with zero pain. Zero. But without sensory awareness of my right arm and left leg, I couldn't move my arm without searing pain. And I mean a pain so bad, I thought my arm would have snapped off. Okay? Now, I had an appointment with my DO, and I wanted him to look at it because I don't assume anything. I wanted someone to outwardly assess. He did some passive range of motion on my arm, and I said, please stop. That really hurts. And he's like, really? And I was like, yeah. I go, hold on, do that again. And I did a hip activation drill, and my arm moved. So I knew right there, although I wanted a quick fix to my shoulder, I had to get back down to basics and take all the factors that led to this frozen shoulder and get my brain to stop protecting it. Did I try nerve glides? Did I try cranial nerve drills? Yes, the best of the best. And it helped for a moment because it wasn't a quick fix situation and frozen shoulder isn't. I had to admit to myself that I needed to do the hard work that I require all my clients to do. And I love that this happens to me. It happens every 5 to 6 years. About 6 or 7 years ago, I had terrible vertigo. And I admit I used to roll my eyes when people had vertigo. Oh, you're a little dizzy. I'm sorry. It effing sucks. Okay? So it was my learning experience. I love it. Gave me an opportunity to critically think and use our methodology, poke some holes in it. And why I bring this up is it poked the biggest hole. While I was teaching a class, trying to get my students to move their whole shoulder girdle, like shoulder blade, arm, everything, we had hands on our spine for feedback. Holy shit. My spine was moving so much when I moved my left arm. Now, you would never know it was moving. You could not tell by looking at me. I even recorded myself and I showed it to our level 3 teachers. I even showed it to a doctor I respect. I'm like, do you see any spinal funk there? They're like, no. I'm like, now feel it. And they're like, holy shit. Okay? Why I bring this to your attention, guys, is stop assuming anything. Assess, test. And if you want to learn more about this, reach out. We've got courses that do this. Remember, this podcast isn't about giving you answers to questions. It's for getting you to think. So if I'm telling you, I then did this with all our students at the Neuro Studio. I travel all around. So I was in Michigan. I was in California. I'm going to Toronto next week. Every single person I test, their spine moves when they move their arm. It's a huge problem in the Pilates community. Now, is the spine moving egregiously? No, but it's not stabilizing. Big problem. And the most common cue I see is like in quadruped, push the floor away, activate your serratus. I'm going to tell you something that's going to piss you off. It pissed me off. It still pisses me off. That cue, everybody is mobilizing their spine, which is then in turn mobilizing their shoulder blade. It's not actually enough serratus. And if we want to really move our shoulder blades, we've got to get reflex stability in our spine. So if you're interested in more about this, come talk. I'd love to chat. I'd love to hear your strategies because we've got to figure this out as a community. It is a huge freaking problem. So think about this. If Meghann could not feel and the top people that she respects could not see that she wasn't stabilizing her spine. What do you think about our patients who are maybe not as good movers or is not as aware? Okay? Nobody's checking this. You guys are. Be curious. Don't look for answers. Look for problems. And then figure out, be like, holy shit. I remember in the class, I yelled. I was like, holy crap, guys. And what was interesting is I got my spine to stabilize. And then in the next class, I did the same exercise. Now, if you're watching me on YouTube, you can see that I'm kind of touching my C7. It didn't work the next time. Why? Because our body compensates. And luckily mine does, because if it didn't, I would die. I was mobilizing my jaw a shit ton. So I need to touch my jaw and my cervical spine to give my brain enough feedback so it doesn't move that instead of that. Okay? And this is why brain mapping is critical. That's why I say I can guarantee results with clients. Not because I'm a freaking magician or using any like groundbreaking shit. It's being able to assess and adjust it at the brain. It's pretty cool stuff. I wish I would have known it. I don't know. You know what? I probably wouldn't have paid attention 15, 20 years ago when I first started. I don't know. Who knows? So, going back to question 1 and 2. How can we better support this shoulder? So I'm going to challenge you guys. Next time you work with frozen shoulder, don't touch someone's shoulder. Use the shoulder as the assessment. Watch the range of motion change when you get their other quadrants and their spine to respond appropriately. Don't just spill out a little bit of problems. Like if you like the threat bucket theory of the idea of decreasing threat, with sleep and all that stuff, great. But get the big guys, clear them up first. Like the most mobile joint in the body, your glenohumeral on the other side, your 2 hip joints. Let me tell you, those 3 not being stable is creating a bigger problem than everybody knows. So start getting curious about this. Start noticing how your client's nervous system is reacting. Are they like more tense? Are they relaxed? Are they breathing? If we have to force breath, that means the nervous system is not relaxed. What are their eyes doing? What are their eyes doing? Okay, there's so many cool things. And now question 3. So I know question 1 and 2 are a little similar, but I wanted 2 different nuances there, okay? Full picture and nervous system. Now, how can we account for hormonal shifts that happen throughout a lifetime? Puberty, childbearing years, perimenopause, menopause, and postmenopause. Now, those all sounded like traditional female hormonal shifts, but men go through puberty. Men have childbearing years. They're, I guess, technically much longer than women, although there is some research pointing to problems with old sperm. Okay? Men have hormonal shifts. Some more than others. Testosterone is going to be a factor. Men also have estrogen in their body. Okay? My dad is going to hate that I say this. I'm not going to say it. My dad has had multiple cancers, and one was estrogen related. And my dad was very confused. And I had to explain to my dad that men have estrogen. That's normal. That's not abnormal. Okay? So I think a lot of men might not know that they have hormonal fluctuations, not as aggressive as women, but there are going to be hormonal shifts. And what happens with hormonal shifts? Okay, I'm not even talking about sex drive and stuff like that. I'm talking about sensation, dealing with pain, skin. Remember, our skin is our largest sensory organ. Does our skin get more taut and responsive as we age, or the opposite? What about our muscles? Yes, you can still build muscles into your 80s and 90s. But if we don't adjust to the sensory feedback our body is getting through our feet, through our hands, through our skin, that's, in my opinion, why a lot of people have trouble building muscles. Yes, there's hormones, but we aren't specific about the sensory changes throughout a lifetime. Okay, when I work with young athletes, I am adamant about not giving a ton of proprioceptive cues. Their bodies are changing. Don't lock them into something that's going to change. working on systems like their visual and vestibular. Let their proprioception follow higher order systems. Okay, we make a lot of assumptions about kids. In my opinion, a lot of the sports-specific training and the specializing too soon is actually is going to affect their life throughout a lifetime, how their body adjusts to sensory input and how their body moves. So what I love and what I've allowed my body to do is have unique sensory experiences. I don't lift 3 times a week. I vary my workouts. I lift heavy. I sometimes lift with no weight or light weight because I want to make sure no matter what I'm doing, my brain and body can respond. And let me tell you, that was my biggest issues. I wasn't a great athlete. I wasn't really coordinated. This surprised people. Maybe it doesn't surprise people. I was the captain of the cheerleading squad. I was a decent enough dancer, but I don't identify as a dancer because I was good at cheerleading, which was like very like sharp movements. The smoothness in movement, that wasn't my skill set, right? So I could always follow choreography. I was always good enough in a sport to make the team, but I wasn't a starter or a good player. Why? Because I couldn't respond to sensory input. My body hurt a lot. I've told this story. I remember like stretching and like practice, and I'd be like, "Oi, my back hurts." And like coaches would be like, "What are you, 85?" And I'm like, "No, my back hurts when I do this hip stretch." And they were like, "I don't know, do something else." Okay. I was good at softball, but I wasn't consistent. One of my coaches, Mr. Ranieri, used to be like, "We need to give Meghann a bushel basket to catch sometimes." Well, I have eye tracking issues. So sometimes my eyes can't converge on a ball. I realized as an adult playing tennis, I asked a tennis pro, "So like, do you see the ball when you hit it?" And he was like, "Excuse me?" And I was like, "Do you like actually see the ball when you hit it?" And everybody says something different. Someone's like, "Yes." Other people go, "Well, I don't actually look at the ball. I see it in my peripheral vision because I'm looking at this." Everybody has different strategies. But what I realized is I don't really see the ball when I play tennis. And I was like, okay, but I'm better now because I didn't actually see the ball. Golf. We went to Top Golf for my birthday with my nieces and nephew. I kept totally missing the golf ball. And I made Brian video me. I shut my eyes every time I was going for impact. So it's kind of hard to hit a golf ball when you're not looking at it, right? So I'm sharing this because we're all so unique. And maybe you suck at sports because sensory input. One of my favorite students at our intensive, he was he still is a dancer. He was like, I was terrible at ball sports. So I picked him and I was throwing a tennis ball at him and he could not catch. And of course I made a joke and we laughed, but I said, hold on a sec. With one eye exercise plus a proprioceptive cue, I threw the tennis ball at him and he was catching it like he was a professional athlete. And I said to him, you are not bad at sports. Your eyes just couldn't focus on the ball. So think about how many kids think they're uncoordinated or bad at sports. There's some underlying things. What about kids who can't pay attention in class? Why am I talking about kids when we're talking about frozen shoulders? Because you are all kids. What was your bugaboo as a kid? What did you always get yelled at for? I mean, now I know my dad used to always tell me to look alive when I was playing softball because my eyes weren't focused. I didn't look focused, right? Now, if I would have understood it back then, maybe I could have worked on it. I probably wouldn't have. Okay, now let's go into later years. Childbearing years, menopause, our skin, our tissue, our body changes again. So why are we so shocked that it's very common women in menopause and postmenopause when proprioception has the biggest change for women? Why are we that surprised that people are getting frozen shoulder? Now, think about all the stupid shit you've done with the body throughout a lifetime. Many women, not all women, I haven't and will not. Many women will have children. Maybe it's vaginal, maybe it's C-section. I don't know. That affects your proprioception. That was pretty traumatic. Childbirth does not get the respect it deserves. So, inability and just doing Kegels and exercises for pelvic floor specifically, I think jams women up worse sometimes. I had a pelvic floor therapist, one of the best, in quote, tell me that a client's scoliosis didn't matter in relation to her pelvic floor issues. Yeah, it does. When you have scoliosis, your spine has a harder time to stabilize. It's going to affect your breathing, your pelvic position. What about the righting reflex? All these things matter, right? So all this lifetime of proprioceptive stuff, injuries, maybe glasses, maybe you have had concussions, maybe you've had other major injuries. All those are piling up. And then when you have a big proprioceptive change, your body's going to shut shit down. We cannot have mobility without enough stability. Okay? So if we go back through all my history, all my sprained ankles, my sacral fracture, I've had issues with my right SI joint for years after my sacral fracture. Okay? My right side is a bit of a problem, both hand and arm. Think about driving. Think about all the things we do with our right side. Although they're more mobile, the brain mapping is not as good and they don't stabilize as well. My left arm, when I had a major proprioceptive shift of a piece of my deltoid and a big chunk of my arm removed, well, my brain was like, shut shit down. Her spine is not stabilizing when this arm moves. That's going to cause a problem. Her right arm isn't, her right leg is not. My brain shut shit down. I have complete full range of motion on my left arm. I can now do push-ups again, pain-free, all this stuff. But let me tell you, if my right side isn't online, I get pain in my left shoulder. I actually posted on my Instagram, I don't know when you'll watch this, but I did like a Pilates exercise called T-pulls, or some people call it pulling straps too. And I demo it, and without sensory input from my right foot, it hurt like bad. So I showed 3 ways to get sensory feedback from your feet. Hey, maybe I'll have Joe put in the show notes. Maybe you can like link it to that Instagram post just so you can kind of see some options here, right? I'm throwing a lot at you guys today for frozen shoulder. So if you were looking for solutions, I just added 20 more things you have to figure out. So to summarize and put a bow around this episode, I had 2 pages of research. So there is research that supports that frozen shoulder is idiopathic and poorly understood. But honestly, that kind of sounds like we're reducing it, reductionism, that it's like that simple. It's super complex. So I don't want you to be like, well, there's no known cause of frozen shoulder, so I'm just going to throw shit against the wall. No, we need to be organized. People want results, okay? So I want you to think, number 1, what questions can you ask to get to the root of the problem? What was their first injury? Because we know that's going to be proprioceptively the shittiest spot. How does their body take in sensory information? Is their spine actually stabilizing when they move their arm? Do you actually know what that means or feels like? And if the answer is no, reach out. Let's talk about it, okay? Because what we don't know, we don't know. That's okay. That doesn't make you a bad teacher. To me, anybody asking that question is actually an amazing teacher because we're willing to figure out what the hell we don't know. I had no idea my spine was moving that much. At first, I was a little embarrassed. And at first, I was a little embarrassed I got frozen shoulder. But fuck that. I'm allowed to get injuries. Now, here's the difference. If I get an injury and it doesn't clear up, well, then that's a problem. I practice what I preach. I stand by everything I say. I do it on my own body. And when that shit doesn't work, that's where I poke Swiss cheese. We make changes. There's way more that I don't know. Which leads me to number 2. It's a protective strategy. But there's also research saying that taking a mechanical approach to frozen shoulder can also work. Because I bet the people using a mechanical strategy, those are people who are intuitive and know how to look at the rest of the body. And they probably do it so intuitively they don't know they're doing it, right? So there's some variables there. And number 3, hormonal shifts. We all know we have hormonal shifts. And the problem is, guys, hormonal shifts, everybody responds differently to them. So we don't really know. But what we do know about frozen shoulder is it's complex. We should never force range of motion. If you are feeling a stretch or discomfort, that is an output. That is your brain telling you to stop what the hell you're doing. Don't believe me? Go into that stretch, do some of my activation drills or some sensory input changes on your other limbs and spine, and watch the range of motion in your arm change. Don't say it doesn't work until you try it. And if you're having trouble, reach out. I'll hook you up. We got to figure this out together because so many people are struggling with frozen shoulder. All right? Don't you point at one thing. Don't you point at hormonal and say, Meghann told you. Don't you point at just the opposite ankle. It's complex. The brain is protecting it. And I think together with our clients, our patients, ourselves, our body, the biggest question we can ask ourselves is, what are you trying to tell me with this pain? Stop thinking that pain is an input. Pain is an output. Pain is indication your brain no likey what you're doing. And for me, telling people to stop doing that is not a solution. But giving people's brain another option and making that more efficient is really where the magic happens. So I hope today has scratched your brain, and hopefully you'll be thinking about frozen shoulder differently. And if you have any further questions, please let me know. I'd love to hear your experience and what's worked out and what didn't. And I want you to think of the things that worked. Don't look at the thing. Think of what that thing did. What did that thing achieve? Oh, this hip exercise cures frozen shoulder. Why? Well, it activated my hip. It helped my brain propriocept my hip so it could stabilize. Think the whys. And if you think the whys, this shit will never get boring, and you can wake up every day excited to help your clients or yourselves. All right, guys, that's it for today. I'll see you next time. Hope your shoulders stay unfrozen.